Hi there, it's Dr. Manny Singh here again. Next week is June 2020. We started practice at our clinic last week, and it went well. There's a little bit of anxiety just trying to get the safety plan in place, but patients came in, they got treated, everybody's happy. The videos were well received, but there's some questions about low back videos. So this will be the low back exercise tutorial that I'll be sharing with you guys today. So if you want to go to my website again, it's Med Rehab Solutions. And from there, we're going to go to the video section and plug into the Canadian Chiropractic Guideline Initiative Exercise web YouTube channel. So these are the latest and greatest exercises from the scientific community, well-researched exercises for the low back. So this program is developed with a lot of different expertise from different experts in the physical rehab field. So the service is really valuable and a great service for the general public. But for you guys, I want you to focus mainly on the low back exercises in this video here. So we want to start with the level 1 exercises for mobility, then move on to level 2 and then level 3. So those are the steps. Step 1 is mobility, step 2 is stabilizing and stretching, and then step 3 will be strengthening. So the pain mobility exercises, we're going to go through those. Actually, I recommend that you go through the entire series from beginning to end. If you have any pain or difficulty with the exercises, go see your go see a local chiropractor and get an exam and a physical and get a diagnosis if you have pain or any sort of dysfunction before you start this type of program. So the exercises here are pretty straightforward for mobility. Knee to chest, child pose, the cat stretch. This is a real nice one. I like that cat stretch followed by the cow stretch, which is dropping the belly low and getting that lumbar spine to arch here. So this part here is really good for resetting the spine into that normal lumbar curvature. Spinal rotation, excellent stretch, really good for loosening up the lumbar spine. You might hear some cavitation, some clicking and popping when you do stretch. Not an issue as long as you don't have pain with it. Great way to help with realigning the low back as well. And this is probably the most difficult exercise out of the group. The pelvic tilts, just because a lot of people aren't aware of these muscles, because it's really a combination of abdominal and the lower back muscles. And to tilt the pelvis is not a common movement that we're used to doing. So an easy way to do it is just to flatten out that curve that you have between the table or the floor, the mat, and your back. So when you flatten that out, you will activate the muscles of the back as well as the abdominal muscles here. So this is one of the tricky ones, but the other ones are pretty much straightforward. So after you've been practicing these for a week or so and you feel like you can move to the next exercise set, then go ahead and do that. The next exercise is going to be stabilization, which is really important. You can't strengthen the spine until you have the alignment sorted and you have the stability sorted out. So I would even go back to my posture video, work on your overall posture as well before you get into the stabilizing part of the exercise program. So in the stability section here, you've got multifidi activation. Those are the smaller muscles along the spine. They do contract just like your bicep can contract here. Same way your multifidi muscles, the muscles on between the vertebrae, those small blocks in your spine, those muscles can contract as well. And if there's problem with dysfunction with those muscles working, it can cause all sorts of mechanical issues and pain. You may need a therapist to help you activate those muscles if you're not, if you don't have body awareness. Same with your transverse abdominis activation. You may need a therapist, chiropractor to help you get those muscles active as well. The next two exercises, so the transverse abdominis activation, it's kind of like a natural belt that works around your abdomen here. So you want to definitely have a strong abdominal abdomen and strong core, and this will help stabilize and keep your back healthy. And you can do these with these balance exercises, stabilization exercises. The bird dog and the bridge are very common exercises used by chiropractors, kinesiologists, and other physical therapy therapists. So this one here is the bird dog, one leg straight and the opposite arm is straight and the spine is level. So listen to the instruction that's given in the video. You can also go to the forum section in my website and print off the PDF. So on my website, there's rehab forums. You can go to that and click on low back, and you have an option for low back level 1, level 2, level 3, and you can read it or you can print it off. I think printing it off is a good idea. You can make notes on the side, how many sets you've done, how many reps, how long are you holding it, the frequencies. So it gives you all the suggestions, 20 seconds, then try the other one, 20 seconds. Here for the cat stretch, hold for 10 seconds. So this is a nice way for you to keep track and keep your notes here while you practice these exercises. So going back to the exercises, we're going to go to the second part of level 2. So the second step, part B of the second step here, are some common stretches that you've probably done before a walk or a jog. Quadriceps stretch here, hip flexor stretch, a hamstring stretch. The figure 4 is really nice. It's a good exercise to get the hip muscles loose, piriformis, glute medius, all those really tight hip muscles that don't get a lot of attention when you're stretching. So do not skip this one here, the hip flexor stretch. Really, in my 20 years of practice, I've seen this muscle be neglected in a rehab setting or rehab plan, or even for treatment for this muscle. It's a tough muscle to get to, connects to the hip. Most of it is behind the abdomen. So it's inside the abdominal cavity, and it attaches here to the spine from the inside. So we can reach the muscles from the outside here, but it's really difficult to get to this muscle. This stretch is one way to really loosen up that hip flexor, and it tightens up when we are sitting for long periods of time. And nowadays, everybody's at their desk. So when you're sitting, that muscle will tighten up and shorten up. So that is definitely one you don't want to skip, hip flexor. Then the hamstring stretch, that's pretty straightforward. So the last part of the program is the strengthening. So once you've done a couple of weeks of both steps 1 and 2, you go to step 3. This is more for strengthening the muscle. So you've got the alignment, you have the stability, you have the flexibility, and now you want to hold it all together and keep it strong. And that's where these exercises come in. This side plank is really good. It helps with the core muscles, the hip muscles, even stabilizes the scapular blade. A really good exercise. It's a little bit on the advanced side. Same with the curl up. So the curl up here, it's modified. So it's kind of like the sit up, but it's modified to be safer. So it decreases the loads on the spine, yet activates the right muscle groups. Your rectus abdominis, your transverse, your paraspinal muscles, while protecting the neck. So the technique that they use in this video is very good. Obviously, it's been backed by this program by the Canadian Chiropractic Initiative. So After all that is said and done, and you try these exercises, the next step would basically be moving on to doing more strengthening and more stabilizing exercise through yoga, or some other type of fitness program. So I will do a probably a short video on some yoga exercises, but for now, I think this is a good start for anybody who wants to, fix their back, make it strong, make it stable. If you do have pain, go see your chiropractor, go see a healthcare provider. Until then, stay safe, stay healthy, stay calm and kind, and we'll see you soon. Take care. Bye.